Welcome back to Health Voices, everyone. We're so glad you've joined us for what we believe is an incredibly important conversation today. Dr. Miller, I want to start with something that's been on my mind. I was speaking with a friend last week, and she was worried about her mother. She's a lovely 75-year-old woman, but recently she's been constantly tired and finds herself out of breath just walking to the mailbox. The confusing part is, she's diligently taking her prescribed medications for arthritis and high blood pressure, pills that are supposed to be helping her feel better. It made me wonder, and I'm sure many of our viewers have felt this too, could the very medicines we trust to heal us sometimes be the source of the problem?
Sarah, that is the perfect way to frame today's topic. What your friend's mother is experiencing is something I see in my practice every single week. It's the invisible elephant in the room of senior healthcare. As a heart surgeon with decades of experience, I've seen countless seniors walk into my office with symptoms just like that: fatigue, breathlessness, a new sense of weakness, and their condition isn't always caused by their diet or a new disease. Often the culprit is hiding in plain sight, right there in their medicine cabinet.
So you're saying that common, everyday pills could be the cause?
Precisely. Many don't realize that some of the most common medications taken daily by millions of people over 60 can quietly damage the heart muscle, dangerously increase blood pressure, or trigger life-threatening irregular heart rhythms. The effects aren't always immediate. They build up over months or even years, creating a slow, silent strain on the cardiovascular system. But I want to be very clear to everyone watching. This is not about fear. This is about awareness. It's about giving you the knowledge you need to be the best advocate for your own health. So today we are going to count down the 7 most common culprits, starting with number 7.
I think our audience is ready. Let's begin, doctor. Where do we start?
We start with something almost every single person has in their home. Pill number 7 is non-steroidal anti-inflammatory drugs, more commonly known as NSAIDs.
You mean things like ibuprofen or naproxen, the pills we take for a headache, back pain, or arthritis. They seem so harmless, so readily available on any pharmacy shelf. What's the hidden danger there?
That's the exact perception that makes them so risky. People associate over-the-counter with completely safe, but that's a dangerous assumption, especially for seniors. These drugs work by blocking enzymes called COX-1 and COX-2. While this does reduce pain and inflammation, it's a bit of a brute force approach. Blocking these enzymes also interferes with critical bodily functions. It can reduce blood flow to the kidneys, forcing them to work less efficiently. When your kidneys can't filter properly, your body retains more salt and water. This excess fluid increases the volume of blood your heart has to pump, which directly raises your blood pressure.
So, a simple pain pill is forcing the heart to work harder every single minute of the day?
Exactly. I remember a patient, a gentleman named Arthur, 72 years old. He was a passionate gardener, but severe gout in his knee was keeping him from his passion. To manage the pain, he was taking high doses of an over-the-counter NSAID every day for years. He had no prior history of heart disease. One day he was brought to the emergency room with acute heart failure. His heart was struggling, overwhelmed. After a thorough investigation, we realized the primary cause was the chronic strain placed on his cardiovascular system by years of NSAID use. We found a safer pain management strategy for him, and his heart function gradually improved, but it was a very close call.
That's a powerful story. So the key message here for our viewers is that daily, long-term use of NSAIDs, even if they aren't prescribed, is a serious conversation to have with your doctor, especially if you already have high blood pressure or any underlying heart concerns.
That is the critical takeaway. Pain relief should never come at the cost of your heart.
Let's move on to pill number 6. You've indicated this one is linked to another very common condition in seniors.
Yes. Pill number 6 is a specific class of diabetes medications called thiazolidinediones, or TZDs. A common one is pioglitazone. They are prescribed to manage type 2 diabetes by helping the body use insulin more effectively.
That sounds beneficial. So how does a medication designed to help control blood sugar end up harming the heart?
This is a classic example of a medication having a powerful intended effect, but also a dangerous side effect. The primary mechanism of TZDs can unfortunately cause the body to retain significant amounts of fluid. It's a similar problem to the NSAIDs we just discussed, but often more pronounced. I like to use an analogy. Imagine your heart is a small, efficient water pump designed to handle a certain amount of water in a fountain. Now imagine someone hooks that pump up to a much larger pool of water. The pump is now forced to work exponentially harder to circulate that extra fluid volume. Over time, that constant, immense strain will wear the pump out. It will become weaker, less efficient, and eventually fail. That is precisely what happens in what we call congestive heart failure.
And for a senior who might already have a slightly weakened heart from age, that extra load could be the tipping point.
It is often the tipping point. What's particularly insidious about this is how the symptoms can be misinterpreted. A person might notice their ankles are a bit more swollen, or they get breathless when they lie down at night. They or even their family might dismiss it as just a part of getting older. But what they're actually experiencing could be the very first signs of drug-induced heart failure. The medication is masking a serious problem that it is, in fact, causing. For anyone with diabetes, especially if you have a history of heart issues or notice any new swelling or shortness of breath, it is vital to ask your doctor if your diabetes medication is truly heart-safe.
That is truly concerning because it shows how one treatment can negatively impact another part of our health. This brings us to pill number 5, which addresses an issue that plagues millions of seniors: sleeplessness.
Indeed. Pill number 5 is sleeping pills, specifically a class known as sedative hypnotics. This includes medications like zolpidem or older benzodiazepines. The promise of a good night's sleep is incredibly tempting, but the long-term cost can be very high.
We often think of sleep as a time of rest and recovery. How can a pill that helps you sleep actually put more stress on your heart?
These drugs don't just quiet your mind, they slow down your entire central nervous system. That includes the fundamental drives that control your breathing rate and your heart rate. During deep sleep, your body naturally needs to respond to changes, like a drop in oxygen levels. Sedatives blunt that response. More importantly, they can relax the muscles in your airway, which can either cause or significantly worsen a condition called sleep apnea.
Sleep apnea, where you stop breathing for short periods during the night.
Correct. Each time you stop breathing, the oxygen level in your blood plummets. Your brain panics and sends a surge of adrenaline to wake you up just enough to gasp for air. This cycle can happen hundreds of times a night. Each event causes a dramatic spike in blood pressure and floods the body with stress hormones. It puts an unbelievable amount of strain on the heart, leading to hypertension, arrhythmias, and an increased risk of heart attack and stroke. So the very pill someone takes to rest their body is actually subjecting their heart to a nightly battle for survival.
And I imagine there are other risks as well?
Absolutely. A major one for seniors is the risk of falls. These drugs can leave you feeling groggy, confused, and unsteady in the morning. Or if you get up in the middle of the night, a fall can lead to a broken hip, a head injury, and a cascade of complications that can be devastating for an older adult. There are much safer, non-pharmacological ways to address poor sleep, and they should always be the first line of defense.
That's a crucial point. A quick fix isn't worth the long-term risk. Let's move to pill number 4. You mentioned this is an older class of medication, but some people may still be taking it.
Yes, pill number 4 is tricyclic antidepressants. These are drugs like amitriptyline or nortriptyline. Decades ago, they were a frontline treatment for depression, anxiety, and even some types of chronic pain. While they can be effective, We now know they carry significant cardiac risks, especially for older adults.
What makes this specific class of antidepressants so problematic for the heart?
It's all about the heart's electrical system. Think of your heart's conduction system as the intricate wiring in a house. It sends precise, timed electrical signals that tell the chambers when to contract in a perfect, rhythmic sequence. Tricyclic antidepressants can directly interfere with this wiring. They can slow down the electrical signals, potentially leading to a dangerous condition called heart block. They can also make the heart muscle more irritable, which can trigger chaotic, irregular heartbeats known as arrhythmias. For a senior who might already have some age-related fraying in their heart's wiring, this interference can be profoundly dangerous.
So newer isn't always just about being more effective, but also about being safer.
That's exactly right. Modern antidepressants, like the SSRIs, have a much more targeted mechanism of action and carry a significantly lower risk of cardiac side effects. They are almost always a safer choice for seniors. The continued prescription of tricyclics is often a matter of habit or cost, but it's a habit that needs to be questioned. If you are on one of these older medications and experience dizziness, fatigue, or heart flutters, do not ignore it. It's a sign that your heart's wiring might be under stress.
It really underscores the importance of regularly reviewing long-term prescriptions with your doctor. Things change, and so does medical science. This brings us to pill number 3, something many of us reach for during allergy season or when we have a cold.
Pill number 3 is decongestants, specifically those containing pseudoephedrine or phenylephrine. They are found in countless cold, flu, and allergy remedies.
It's almost hard to believe. How can a simple pill to clear a stuffy nose pose a threat to the entire cardiovascular system?
The mechanism is quite aggressive. To reduce swelling in your nasal passages, these drugs work by constricting or narrowing blood vessels. The problem is, they don't just constrict the blood vessels in your nose. They constrict blood vessels throughout your entire body. I want you to imagine you're watering your garden with a hose. Now imagine someone walks along and squeezes the hose tightly in several places. The water pressure inside that hose will skyrocket, and the pump back at the spigot has to work much harder to force the water through. That's exactly what these pills do to your circulatory system. Your blood vessels tighten, your blood pressure shoots up, and your heart is forced to pump against immense resistance.
That's a very clear and alarming analogy.
It's meant to be. I once treated a patient, a lovely woman named Margaret, who was getting ready for her granddaughter's wedding. She came down with a bad cold and, wanting to feel her best, took a maximum strength cold and sinus medication. A few hours later, she was in our emergency room with a hypertensive crisis, dangerously high blood pressure, and a heart rate over 140 beats per minute. The decongestant had pushed her system over the edge. For a senior, especially one with even mild controlled high blood pressure, these drugs can be like throwing gasoline on a fire.
A powerful reminder that over-the-counter does not mean risk-free. That's a lesson we're learning again and again today. Doctor, let's move to pill number 2. You've said this is something millions take daily for a very common digestive issue.
That's right, Sarah. Pill number 2 is proton pump inhibitors, or PPIs. These are incredibly common medications like omeprazole or pantoprazole used to treat acid reflux and heartburn. Many people take them for years, believing them to be completely benign.
The connection here seems less obvious. How does reducing stomach acid impact heart health?
The link is indirect but profound, and science has only uncovered it in recent years. Stomach acid, while causing discomfort and reflux, is absolutely essential for absorbing key nutrients from our food. One of the most critical of these is magnesium. PPIs are so effective at reducing acid that they can, over time, lead to a chronic, low-grade magnesium deficiency.
And what role does magnesium play in the heart?
Magnesium is the great stabilizer of the heart's electrical system. If the heart's wiring is the hardware, magnesium is like the software that ensures all the signals are smooth and steady. When magnesium levels are low, the heart's electrical circuits become irritable and unstable. This can lead to palpitations, fatigue, and serious arrhythmias like atrial fibrillation. But there's a second emerging concern. We now know that long-term use of these drugs can alter the delicate balance of your gut microbiome, the trillions of bacteria living in your digestive tract. This disruption can lead to a state of chronic, low-level inflammation throughout the body, and we know that inflammation is a primary driver of atherosclerosis, the hardening of the arteries that leads to heart disease.
So it's a double hit: nutrient deficiency and system-wide inflammation. That's truly eye-opening. And now, we've arrived at pill number 1. You describe this as the most dangerous on the list. What is it?
Pill number 1 is a class of drugs called calcium channel blockers. And the reason they are number 1 is the sheer irony. They are often prescribed to treat heart conditions like high blood pressure and chest pain.
Wait, a heart medication is the most dangerous pill for the heart? That is deeply counterintuitive. How can that be?
Because it is a powerful tool that requires immense precision, and that precision is often lost in long-term care for seniors. These drugs work by blocking calcium from entering the cells of the heart and blood vessels. This relaxes the blood vessels, which lowers blood pressure. However, certain types, particularly older ones like verapamil and diltiazem, also have a very strong effect on the heart muscle itself, causing it to slow down significantly.
And for an older heart, that slowing down can go too far?
It can go much too far. A senior's heart may already have a reduced functional capacity. When you add a medication that puts a powerful brake on its rate and pumping strength, you can end up with a dangerously low heart rate, a condition we call bradycardia. This leads to profound fatigue, dizziness, fainting, and an overall inability to function. The most tragic part is how these side effects are often misinterpreted. I have seen so many patients whose families and even doctors have attributed their lethargy, swollen legs, and shortness of breath to just getting old. They assume it's the natural progression of age, when in fact it is a direct side effect of a heart medication that is now too strong or no longer appropriate for them. The dose that was right at age 65 may be dangerous at age 75.
So the pill itself isn't evil, but the lack of ongoing reevaluation is where the danger lies. The idea that we must not attribute everything to age is perhaps the most important theme of our conversation.
It is the single most important message. We must stop blaming age for symptoms that could be caused by medication. If you are on a calcium channel blocker and you feel progressively more tired, dizzy, or swollen, it is not just old age. It is a warning sign from your heart that needs to be addressed immediately.
Thank you, doctor, for walking us through that entire list with such clarity and powerful examples. As we wrap up, what is the final thought you want to leave with every single person watching today?
The final thought is a call to empowerment. If you are over 60 and you are taking any of the medications we discussed today, I am not telling you to stop them. Let me repeat that. Do not stop any prescribed medication on your own. The goal of this conversation is to give you the confidence and the vocabulary to have a better conversation with your healthcare provider. Your mission is to become an active, educated partner in your own health. Go to your doctor, go to your pharmacist, and ask the critical question, given my age and my current health, is this still the safest and best possible medication for me?
Be proactive, not passive.
Exactly. As a heart surgeon, I have seen too many people land in my hospital not because of their underlying disease, but because of the predictable, preventable side effects of their treatment. You have the power to help prevent that. Stay informed, stay alert, and never ever be afraid to question the pills you are taking. Your heart is far too precious to ignore.
Dr. David Miller, thank you for this incredibly valuable and potentially life-saving information. And to our wonderful audience at Health Voices, We truly hope this conversation has empowered you. If you found this video helpful, please show your support by clicking the like button and subscribe to our channel so you never miss these important discussions. We also encourage you to share this video with your friends, your parents, or anyone in your life who could benefit from this knowledge. And finally, we would love to hear from you. Please leave us a comment below. Are there any other health topics or concerns you would like us to cover in a future video? Your input helps shape our channel. Thank you so much for watching and be well. Stay heart strong.